Here at home, advice around the consumption of alcohol, specifically when it comes to health risks, could be about to change in a big way. Now, with summer winding down, you might be making plans to get in some drinks on patios or a glass of wine or a couple of beers with friends. And what's the harm in that? But the scientific body that advises the government on alcohol consumption says those drinks add up fast, and it doesn't take long to get to a number that can be bad for your health. Let's bring in Hilary Johnstone on this story out of Ottawa. Good morning, Hilary. This is all coming from a new report from the Canadian Centre on Substance Abuse and Addiction. What are some of the findings?
Well, Hannah, the report is saying that any amount of alcohol use, even if it's just a couple of drinks a week, has a negative impact on a number of disease outcomes, whether that be cancer, whether that be cardiovascular disease, whether that be liver cirrhosis. So when you take a look at sort of these new findings, and the last ones were done more than a decade ago, showed that you could have 10 drinks a week for a woman, 15 drinks a week for a man. This new report is showing something very different. And what we're hearing from researchers is that the science has changed. So if you take a look there, no drinks a week, you have no risk. But even just a couple of drinks there, you still have a low risk of having negative health outcomes for a number of different diseases. A moderate risk goes up if you're having 3, 4, 5, 6 drinks a week. And if you are having more than 6 standard drinks a week, your risk becomes incredibly high for a number of diseases and to have bad outcomes with those diseases as well. So when we're talking about what is one standard drink, well, it could be 1 glass of wine, it could be 1 glass of beer, 1 bottle of cider, like you can see there, or 1 shot glass of spirits. So it doesn't take very much. And of course, during the pandemic as well, we've been hearing from people that they have been drinking more during the pandemic. A Statistics Canada report from last year showed that. And when you're talking about breast cancer as one example, because the researchers are saying here that women are particularly at risk, your risk of dying from breast cancer goes up by 10% if you are consuming more than 6 drinks per week. So I want to play a little bit now one of the researchers who is the co-chair of Canada's low-risk alcohol drinking guidelines with what she told us.
One of the reasons why previously the guidelines were higher is that there was this conception that alcohol had some benefits with regards to some cardiovascular diseases. More recent studies now find that that is probably not the case anymore.
So very much changing science here, Hannah, and we've heard from people that they weren't aware of this, that, previous research had showed that perhaps a couple drinks a week was okay. What we're learning now, according to these researchers, is it's not.
So what are the experts saying we do now?
Well, one of the suggestions is that we should have warning labels on alcohol bottles with the risks. There has been a pilot project in the past in Yukon, and we've heard from a radiation oncologist in particular in the Toronto area who talked about what he would like to see in terms of those warning labels, what could be effective. Here's what he told us.
From a warning labels point of view, I think there's actually a lot of science in terms of what an effective warning is. And it has to be big enough. It has to be well placed. It has to be eye-catching. Pictures do better than words. Colors do better than black and white. The more you drink, the more cancer you get. That's the bottom line.
A pretty troubling bottom line for sure, Hannah, but definitely something that is good for the public to know, which is why these researchers say they are putting out this new report.
Okay. Thanks, Hilary.
Thank you.